This is something extremely painful, but it was not as painful as I expected because I suffered so much during a number of years, because this disease went with me since 44 all the way to 2016. I went from the late 90s all the way into 2016 with that disease. When I was 42, I started having urinary retention. I've had to use a lot of catheters each time that I had a structure, but we didn't know that. So I had some procedure done where the catheter inserted more damage into my system than helped me. So it becomes a problem years after, and it gets to a point where my prostate issue gets grave to a level that I had to have a procedure done every 6 months. Well, I'm Joe Celestin, Haitian American, came to the United States 50 years ago. I was educated here for my secondary education at the University of Florida. I have a master's in engineering and architecture. And I'm a politician and a businessman and a husband and a father and a grandfather and a great-grandfather. It was the greatest honor that I was given by my community when they selected me to serve as mayor of the city of North Miami. I was the first black in Florida to be elected mayor of a large city, and also the first Haitian American elected mayor in the United States. Very, very, very much honored and humbled to serve these people that came out, and we made history together. Remember, I mentioned to you that I was the first black in the state of Florida, not just Haitian. I was the first black person to be elected mayor of a large city in the state. This is the Deep South. It's rare that a black person would be elected mayor to serve in a large city. On top of that, I was elected in a Democratic city, and I am a Republican registered member. Running against a bunch of Democrats, and I won in a Democratic district where the Democratic voters voted for a Republican over 3 other candidates that were Democrats. How I discovered that I had urinary retention is that when I pee, I was not discharging completely. And I was dribbling sometime. And it's just like my bladder was never completely empty. And I didn't know that for a while because the disease didn't just happen. It progresses long term until it gets to a point where the discharge was less and less and less. When you have damage done into your prostate or your urethra, and then the interior of the wound was not able to heal properly. In the healing process, you build up a lot of tissue, overgrown tissue inside. So when that happens, you block the flow. And then in addition to that, then you end up with what they call a prostate enlargement. So you suffer during that time from a very enlarged prostate that definitely squeeze your urethra. So your inability to pass urine backed up completely in your bladder, into your kidney. You end up having all kind of issues. You want your bladder, it's not discharging the right way or the quantity. Sometimes I would go to the bathroom like 6 times or 8 times per night, because each time I go, I can only let go or discharge a very small amount of liquid. So another half hour, I gotta go again. But that backed up of waste, which is the urine is waste, it's not healthy for your bladder or for your kidney. So I always had kidney issues and always had bladder issues, creating bacteria in the area and causing all kind of problems, all kind of health issues. I used to suffer high blood pressure due to the fact that kidney issue, then I have high blood pressure that I did. Now I no longer have the high blood pressure because I no longer have those problems. Because it was all related to the backed up of urine into my bladder, into my kidney. The discharge, because the cleaning process was not being done properly. So it's just very, very, and there's help for that.
My name is Dr. Angelo Gousse, and I am a board-certified urologist. I am a male and female reconstructive surgeon, and I reconstruct male genital tract as well as female pelvic floor and genital tract. When you have urinary retention, technically is you are unable to urinate, so you're unable to pass urine. So your bladder's full and you want the urine to come out, but it won't come out. And usually it's extremely painful and you feel you should be urinating, you want to urinate, but nothing comes out essentially. So that's pretty much what urinary retention is. In urinary retention, male patients are more at risk for urinary retention than female patients. And the reason is the majority of cases of what we call acute, it happened all of a sudden, you can't urinate at all, is related to prostate disease and particularly enlargement of the prostate gland. And so men tend to have that, but obviously anything which blocks the flow of urine out of the urinary bladder can cause urinary retention. For instance, the channel where the urine comes out is called the urethra. And this channel can develop scar tissue for various reasons. And when this scar tissue develops, they can block the flow of urine out of the urinary bladder. And this can certainly cause urinary retention as well. Sometimes it could be a stone that is stuck in the channel, in the bladder neck, or in the urethra itself. It can cause urinary retention. Another less common cause of urinary retention are neurologic conditions which affect the nerves which supply the bladder. There are patients who go into urinary retention. It's due to a nerve damage, to a neurologic condition. It could be something like multiple sclerosis. And you wouldn't think multiple sclerosis could cause urinary retention. Yes, it could. And what happens is sometimes the urinary retention presents before the overt neurologic symptoms, even before the weakness, the numbness, the double vision we see in multiple sclerosis. The urinary retention comes first. So these patients don't have any blockage. If you examine for blockage, everything will be normal, but the nerves are affected. Like some patients who have spinal cord injury can develop urinary retention because the nerves that supply the bladder don't function. It could be something very common. A lot of people don't realize that diabetes can affect the nerves which supply the bladder. So some diabetic patients go into urinary retention, and it's because the nerves don't function. So, and sometimes some patients have both. A little bit of blockage, a little bit of nerve problem. And there is a very sophisticated instrument or diagnostic instrument which allows us to measure precisely the degree of blockage and confirm the function of the muscles and the nerves of the bladder. And very few urologists perform this test routinely. It's called urodynamics. And we have it in the office, obviously, and the urodynamic is the only diagnostic test which confirms with almost 100% certainty the diagnosis of what is called bladder outlet obstruction, which means blockage of the urinary bladder and the way the muscles of the bladder are trying to push, but yet there's no flow. So when you have high pressure of the bladder trying to push, but no flow, and the instrument called urodynamic can measure it, then you have a firm diagnosis of urinary retention. Because if you make the wrong diagnosis, you can do a surgery, it won't work because the nerves didn't work. So you should know that before you do the surgery. You should evaluate for all these aspects before you treat the patient. Well, the impact, the quality of life of patients with acute urinary retention is huge. It's astronomical because these patients, when they are unable to urinate, most of the time or many times it happens unexpectedly, and it can happen at home, it can happen in an airplane, it can happen at a cruise, it can happen at anywhere.
You couldn't sleep because you have to get up every half an hour, so.
They have no way to relieve their bladder, and it's extremely painful. And many patients describe that acute urinary retention is worse than labor pain.
Your quality of life was suck. I mean, I couldn't even travel. I used to travel and having people in the plane fighting me off because every so often I have to get out. Especially when the pilot said, everybody have to sit down. And I can't sit down because I got to go pee every so often. So for me to describe this to you, it was a nightmare. My life has changed. Unfortunately, at times, the nature of what causes the urinary retention prevents the clinician, the healthcare provider, from being able to drain the bladder. Then that becomes a bigger problem because sometimes we have to go another route, poke a hole straight directly from the skin in the bladder to drain the bladder. It becomes more complicated. But once you have a catheter in your bladder, the urine will come out to a bag, and you can walk around with it. But imagine a male patient walking around all the time with a plastic tube in their penis. Obviously,
they can't be sexually intimate with the tube in their penis. It's not attractive. They lose confidence, and it becomes a problem. Patients who keep on having this happening over and over, they really feel they don't have a life. They're always scared that one day, wherever they go to a wedding, it happens. They go on a cruise, it happens. They go on an airplane, it could happen, because of the impending possibility that they will go into urinary retention, so they avoid a lot of situations. So many patients avoid traveling, they avoid going on cruises, they avoid going on planes. They always look for places which might have a hospital in case they run into trouble. And their life revolves around if one day this happens to them and they are unable to relieve their bladder. So many of them, their quality of life changes drastically, and it affects their sexuality and their self-esteem.
The day that I came to Dr. Gousse was because I was in an operating room with some doctors, and they made a decision to do a bypass and allowing me by putting a tube in my belly so I can discharge my urine. And my wife was there, and at the conclusion she said, "Okay, honey, I love you. Go ahead and do that. You know, it doesn't matter." And I was crying, and I've heard one of the doctors said, "This guy is so bad, condition is so bad, the only guy who can probably do something for him is Angelo Gousse." And when I heard the name of Angelo Gousse, I said, "I know the guy, let me give him a call." And I called him for the first time, and we went over the situation, and he said, "I'll look at the x-ray. I can't promise you anything, but why don't you come by and see me?" And so I told the doctor, cancel the operation. I want to take a second opinion with Dr. Gousse. So he said, "It's going to take you 6 months to see Angelo Gousse." So I told him, let me handle it myself, because I can call Angelo Gousse. So when I called Dr. Gousse, he was good enough to see me the next day.
Joe, his issue was that urinary retention. He could not urinate. He went into urinary retention many times. He had a lot of burning when he was urinating. His life was completely miserable, and he withdrew from a lot of travel, a lot of engagement because of the situation. Once we evaluated him, we figured out that his channel, called the urethra, had scar tissue in it. It was blocked, so his bladder could not empty. And if you only cut the scar tissue, it tends to come back. So the decision was made to reconstruct the urethra. That means to give him a new urethra. And, you know, obviously, where do you find a new urethra? You can't buy it. You'll have to fashion it. And one technique which exists is that we are able to use the lining of the mouth, called the buccal mucosa. That's the lining of the mouth. One able to harvest it, scrape it, and refashion it into half of a 3/4 of a tube, and then reconstruct the urethra with the lining of the mouth.
This operation is as major as an open heart surgery. So, but it took me about close to 4 months to recuperate partially, but full in gear probably 6 months.
The main requirement is to leave a urethral catheter for about 3 weeks. The same way after you have major orthopedic surgery, they leave a cast. So the reconstructive urologist, after they violate the urethra and reconstruct it, they will leave something to allow proper draining, and we leave a catheter in the bladder, in the urethra, for approximately 3 weeks. The wound itself usually heals within 4 weeks, pretty much. I tend to use sutures which absorb themselves, so there's no need to go back to actually remove sutures or anything like that. The wound care is pretty benign. And from what I've been told by most of my patients, it's not a very painful recovery. Interestingly, even where we harvest the graft from the mouth is not that sore for a prolonged period of time. It's like you bite your cheek, in a day or two, start feeling better, and you're able to eat normally within 48 hours.
And since that operation, I no longer have any overgrown of skin. I no longer have infections. I no longer have backed up, God forbid. I no longer have bladder retention. I no longer have kidney issues. He resolved all my issues. I'm on the radio, and often I talk to guys about the prostate issues. Part of the thing with this, with us men, and or any condition that has to do with your private part, it's just like you don't want to talk about it, and you don't want nobody to know about it. You don't want to go to the doctor. It makes you feel deficient for people to know that you're not well down there. So we kind of endure a lot and stay silent, not even going to the doctor, not even talking to anyone. Rarely you will have guys talk among themselves, but for the most part, this is not something guys talk about. And this is not something you talk about to anyone. So I would urge anyone who has anything, any condition that has to do with your prostate or your bladder related to your urinary tract, to quickly move fast.
My advice for those who experience urinary retention is not to think it's going to go away on its own. 95% plus of the time, it's going to require some type of treatment if it keeps on happening. If you go into retention more than twice, chances are it's going to happen a third or fourth or fifth or sixth time, unless you are evaluated and properly treated by someone who's experienced and skilled, and not only in the treatment, but also in the diagnostic aspect of urinary retention.
My life has changed. I mean, I've been to many doctors. I've had procedures done every 6 months into that area to keep me going. And I've suffered a lot until the day I met Dr. Gousse. He's a gifted guy. He's got a gifted hand. He operated on me twice. I told Dr. Gousse that after the surgery, me and my wife, we went to Europe because I now can travel for 8 hours in an aircraft, and it was possible after, he operated on me. So I have him in my will. I'm giving him some money.
I'm Cindy. I'm studying to become an English teacher, and I love Island TV. Why? Because we are the Caribbean. We are Island TV. We need to reveal our fundamental contributions in America. We need Island TV to reveal our different beautiful Caribbean cultures for the world to respect and understand us better. Grow your business while supporting the only Caribbean television station in Florida. Advertise with Island TV.